Welcome to DermTube's meeting coverage of the 2017 Summer AAD meeting here in New York City. I'm Dr. Samal Desai from Dallas, Texas, and I'm your host. Today I have the pleasure of speaking with Dr. Nicole Rogers, who practices in New Orleans, Louisiana, and is really a world's expert on hair disorders and alopecia, and she's going to give us an update today on one of these challenging topics that we all face in our practices.
Well, we only have a limited number of treatment options for androgenetic alopecia, which are specifically FDA approved. So we're often looking for other options. How can we help maximize our patients' ability to regrow their hair? And one of the most interesting new things of late has been the application of platelet-rich plasma toward the treatment of male and female pattern hair loss. And it's a simple technique in that it involves drawing the blood and spinning it down with a high-speed centrifuge and then extracting off that platelet-rich portion and injecting it back into the areas of hair thinning. What we don't know about PRP is what's the best protocol. And so there's a lot of variations in the techniques that are being used. You know, there's obviously differences in the concentrations that we can achieve, based on the spin techniques. Some may achieve higher platelet concentrations than others. We also don't know what's the ideal frequency. Should we be doing this every month for 3 months? Should we be doing it, every 6 months thereafter? There's a lot of things that we just don't totally understand. So when you ask, is it ready for prime time? I think the short answer is no, but for those of us who treat hair loss on a regular basis and who are in desperate need of more treatment options for our patients, I think this is a wonderful place that we can start experimenting and finding out how it can help our patients. So post-finasteride syndrome is something that has only recently been described, and it's related to changes in mood and changes in libido that can persist even after the discontinuation of the drug finasteride. And to the extent that we don't know exactly who's possibly going to develop it, for that reason, we haven't stopped prescribing finasteride for the use of hair loss. It really can be such a miracle drug, and especially for patients with a very strong family history of hair loss, they may start noticing hair thinning at a very young age. So the sooner we can get them started on that, the better. And for patients who are worried about side effects, number one, I try to reassure them that the half-life of the medicine is very short. So if they have a problem, they just go off of it, and it should be out of their system in 3 to 4 days. The other thing that I tell them is that, that is not the only treatment option. We can always talk about using topical minoxidil first, or in some instances, oral minoxidil. That can also be a treatment option at very low doses. We're finding more and more evidence that that can be helpful in regrowing hair. But for patients who are very nervous about side effects, one option is to start off just 2 or 3 times per week with a 1 milligram dosage, and then sometimes increasing it from there and realizing that they're not having any kind of side effects and that they can go ahead and stick with the medicine. There's a class of medicines called JAK Inhibitors, which have been so far only FDA approved for things like rheumatoid arthritis and myelofibrosis. However, they can have a very powerful effect in terms of downregulating the body's immune system and reducing certain pathways of T-cell upregulation, such that there isn't the same attack on the hair follicles that we see in alopecia areata. And this was discovered serendipitously in a patient who was treated by Dr. Brett King of Yale for both psoriasis and alopecia universalis. And this patient improved with the treatment of tofacitinib in particular. So subsequently, we've had more data and we've had larger studies showing that it can be used both by mouth, systemically, as well as topically to try and help regrow hair for patients with alopecia areata. And our goal in the future is hopefully to have some FDA approval such that hopefully insurance companies will start covering the drug for our patients who need it so badly for their hair regrowth.